Hey Cam followers, thank you so much for being here. This is now episode 6 where we are going to be looking at the diagram. We're doing the cube on the furthest to the right on the lower level, working with your vet. What does that mean? This is really important that you guys understand how this works. Vets legally are the only people that are allowed to diagnose, and they're the only people allowed to prescribe. So when you're managing arthritis, which is a chronic pain condition, you need to get a diagnosis, and you're more than likely going to need prescriptions at some point in this disease process. So we need to help you work with your vet better, and we're going to give you a few tips how to do this. So me and Gwen work very, very hard making sure that we listen, we're receptive, we're available. But sometimes I have had people that just haven't related to me, and it isn't bad on them and it's not bad on me, it's just we just haven't connected. If that is the case, if you are with a vet and you just don't feel that you communicate well, don't be scared about asking if you can see another one within the practice. Generally, most practices will have anywhere between 3 and 20 vets in one practice now. So try and find that vet that listens to you, you understand what they say, they're clear, they give you realistic goals and targets, and work with them and try and stay with them, because you are allowed, when you're booking an appointment, to see the same vet. You can request to see that vet that you have a rapport with.
Yeah, you might have to be a little bit flexible with when you see them, because they probably run surgeries only certain times during the week.
Yeah, but it might also be a nurse. So something that Cam is really, really passionate about is utilising our veterinary nurses better. Now, these are really skilled individuals that generally have done 3-4 years worth of trainings. You know, some of them have master's degrees. You know, they're really, really capable people, and they are more than capable of managing an arthritis clinic. Yes, they're not allowed to diagnose, and yes, they're not allowed to prescribe, but they can work very closely with the vet in charge of the case, but fill in the gaps, keep the communication, and give you that support that you need, be it information, advice, or even just emotional support, because it is a hard disease in the long term. So working with your vet, just following on from prescribing and diagnosing, I want to jump slightly into the therapist world. So we know that medications aren't the only way to manage this disease, and we encourage you not to rely simply on medications. Arthritis is very much a lifestyle disease, and it needs other interventions, and that might be physio, it might be hydrotherapy, it might be massage therapy, it might be laser therapy, it might be acupuncture, it might be exercise adaptation and therapeutic exercise introduction. There's loads of things that can be done. But when you're exploring these avenues, you need to make sure that that person is working with your vet, because your vet is still the only person that is allowed to diagnose and prescribe. And we need to make sure that that therapist and that vet have a connection. Now, you're really lucky. You're in a very superb place to be working, because you actually have face-to-face contact time, don't you?
With the physiotherapists, etc.
Yeah.
Yes, we have a team of physiotherapists and a hydrotherapist. I also have direct access to my specialist orthopaedic colleagues and things like that. But quite often people are coming quite a long distance, so I'm actually finding them people closer to home for the regular therapy, because they can only come and see me once a month max. Sometimes I only see them once, because I'm actually then handing them back to their own vet and finding them a local physiotherapist, a local acupuncturist who has to be a vet, so that they can get regular treatment close to them. But then I will keep that contact up with them and their vet to guide their vet through some of these slightly more specialist.
How do you
telephone and email.
So you're quite
so I have a lot of people come. I'm based just south of Bristol. A lot of people coming from the depths of Cornwall, for example. And it's not practical for them to come every week. It took them 3.5 hours to get to me. So I try and work with the therapists and the vets local to them, so that they can get that treatment they need.
So how do you do that? So if you've got an owner whose vet has diagnosed bilateral hip OA, also some elbow problems, and they are now looking at exploring a bit of pain intervention with some medicines, they're on a weight loss plan, they've done their house adaptations, they've modified their exercise, but they're now going to hydro. And they know that their expectations are hydro is going to be a number of sessions in quick succession leading to a potential management plan. Expectation there, guys, did you see that? Their expectations is it's not a quick fix, it's not 3 weeks of intensive swimming and then you're okay. It's about going on to a management plan. How can that owner, the hydrotherapist and the first opinion vet converse? What do you do?
I think I would, if I was the first opinion vet, I would like to have regular updates from the hydrotherapist. By law, though, anyone doing a manipulative therapy on an animal has to get permission from the vet. So they will have had to have a consent form signed from the primary vet. So they've got that link there. They've already got a communication channel. So the vet should be asking for regular updates from the hydrotherapist or the physiotherapist.
Yeah.
And the slight problem is that most vets, we're not trained in physiotherapy and hydrotherapy, so we don't really know what to expect ourselves sometimes. So what I'm looking for is a progressive improvement in my reports, and possibly if there's no improvement happening, I'll want to speak to the physio or the hydrotherapist to ask them, do they think that the animal's actually painful and that's stopping progress? And that's then my job to try and maybe introduce a medication.
Or maybe there's a comorbidity that's correct in there.
To examine the animal, make sure there's nothing else wrong. Facilitate physio and hydro by giving pain medication where appropriate.
Which we're going to come back to in another episode, why we need to do that.
Because sometimes actually the animal is sufficiently painful that the physio and the hydro are really unpleasant. And then you can just make things worse, actually. But what we're trying
to get owners to understand is that for the sake of you, your animal, your energy, your finances, your physical input, having good communication between you, your vet, your therapist, or whoever else is involved is really, really important. Because at the end of the day, the buck stays with the vet. The vet is the person diagnosing and managing and overseeing your case to the best of their ability, and they need to have that information coming to them. Tips for any therapists that are watching this. Quite often, as Gwen said, you speak a different language. We speak a different language to you. We need to learn how to speak without keeping people out of the conversation. So think about the way that you write your report. Make sure that it is interpretable. I know that I've had some and I'm like going, I don't know what that means. So if you are in that situation, then follow up with an email, follow up with a phone call. So that's just a little tip. And a little push, Cam has got the Cam OA booklet. And what we've tried to do is make this often bottleneck situation easier. So within the booklet, Cam OA booklet, there is a section for therapists to write a report, a very quick, brief update, so that you don't have to go home and write these lengthy reports, which are very time consuming and quite hard to complete. After the session, you can just quickly write what the dog did, how it got on, and how you feel it's progressing, because that's within that book that's going to go straight back to the vet for the next appointment. So there is that really safe backup plan there. So I would really strongly suggest the Cam OA booklet is designed to help this sort of situation. Okay. So that's episode number 6, working with your vet. What we try to do is make everything practical for you guys. We don't want you going off and getting lost. The reason I say this is me with my own dog, Holly, being the person that knows as much as I do, towards the end of her life, I did find myself going off and getting lost, trying different interventions and not coming back to base point. Your vet is your base point. Your vet is there looking after you. So please include them with any of changes that you've put in place, any therapies that you're pursuing, any supplements that you've started, because they do play a role. A number of supplements that we're going to come back to later can interfere with your medication. That vet needs to know. So have it all written down and make sure you have a clear demonstration of what you're up to. Yeah?
Yeah, absolutely.
Cool. Episode 6 done. We'll see you for episode number 7, where we talk about something that is really, really critical, and Gwen touched on it. Pain control is imperative for everything else to function. So we're going to speak to you in episode 7 about the importance of pain control.